The Suncoast is the proud recipient of some very good medical news. A health ranking survey ranked Sarasota County number 2 in the U.S. for overall health factors and number 6 for overall health outcomes. Dr. Mala Singh from Gulf Coast Medical Group is here to explain the importance of these rankings. Welcome, Dr. Mala.
Thank you. Thank you for having me.
Yeah, so this is exciting, but we really want to know what it actually means. So, we rank very well. We know now in healthy lifestyle. So, what does that mean as far as the factors?
Well, it's a whole lot of parameters we're looking at. We're comparing ourselves to number 1, which is St. John's, number 2, which is Collier County, and we're looking at different parameters like clinical things like access to health care, exercise, obesity, smoking, all the different things that we've talked about.
So these are the factors that go into determining this overall health outcome where we ranked number 6.
Yes.
So when we look at it's not just a matter of one piece, it's all 4 of these together. So more importantly to our health, what should we be doing better? I mean, how can we improve?
I'd like to see us number 1. And there's a lot of things we can do. The main focus of what I'm seeing is things like obesity. 1/3 of the adults in the U.S. are obese. Smoking is still a big problem, even with all the education we have out there. Smoking.
Inactivity, I see. Inactivity and access to exercise?
Inactivity to exercise, alcohol-related deaths. STDs are rising in adults and teenagers.
Still in our area, so that is definitely an area for improvement.
Teen births, there's about 200,000 teenagers that give birth every year. So that's a big rising problem, even though it has decreased since the last year, and that may be because of counseling and use of contraceptives, but it's still a problem.
And as you get to see, your patients come through here on the Suncoast, yes, it's great to celebrate that we made the top of a list like this, but there is still this very important need to improve. We shouldn't rest and relax yet.
No, we shouldn't. Access to healthcare is a big problem. We need to get better access, and we need our legislators to do something so every person in the United States has access to healthcare, access to their doctors. Not only that, seeing your doctor is good, but Compliance is a big problem. Just going to see your doctor and meeting with them and getting the recommendations, following the recommendations are very important. So just seeing the doctor and coming home and saying, okay, I saw my doctor, but now I'm not going to follow through with what he has to or she has to say. So that's really important. I see that in the elderly, that Sarasota has a large senior population, and they're very well managed. They have their physicians, they have access to health care, they're very compliant, they worked very hard, they saved up, and they want to live, they want to be happy in their retirement, right? And like we talked about, retirement is a state of mind. Now, retirement and happiness is a state of mind. So, but now with the younger generation, it's a big challenge. They have very poor access to health care. They are struggling. Teen moms, single mothers, they're all struggling. Poor access to health care. They're working 2 jobs. They don't have any access to exercise because they're so busy working, taking care of the children. So that's a big problem.
What about room for improvement in mental health services?
Mental health, compared to number 1, we are lacking in mental health providers. And we definitely need more mental health providers in this area.
So, all right. Well, so there's some great takeaways here, and that yes, it's great to be acknowledged, but there's still a lot of work to be done, and it does still rely on each individual. So we don't celebrate yet, but you can find out more by talking to Dr. Mala further. You can find more information at gulfcoastmedicalgroup.com. You can visit their website. Coming up next, we'll learn about luxury cake design with Julie DeFons.